Hi guys, welcome back to Navigating the Periphery. My name is Deborah and this is my son Philip.
Hello.
How is everyone out there doing today? If you're into what we're doing on this channel, you know what to do. Please like and subscribe below. We want to get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis, one show at a time. If you know anyone who could benefit from watching this channel, please help spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone. We're here.
We are. So, Philip, how are you doing today?
I'm doing okay today, Mom. How are you doing?
I am good and ready to get into today's topic. But first and foremost, I want to stress that the content on our channel is for informational and educational purposes only, and it is not intended as medical advice. Please always consult a healthcare professional for medical advice, diagnosis, or treatment, and never disregard professional medical advice or delay in seeking it because of something you have watched on this channel.
Yes. I am here to speak only on my personal experiences with my illness to try to help others with their journey and to feel less alone in their struggle.
Yes. So please see our full disclaimer at the end of this and every episode that we put out. Without further ado, Philip, take it away.
Today, we are going to discuss some not so pleasant effects of psychiatric meds. I've noticed recently some things in our past videos that kind of bothered me. I have noticed I do have some tic-like movements, whether I'm scratching, like this, or just involuntarily moving, and it makes me very self-conscious at times. There's nothing I can really do about it, but it still bothers me. No one likes to feel self-conscious. It just adds to the perpetuating stigma surrounding a mental illness, diagnosis, or any other mental health diagnosis. So that's what I would like to cover in today's episode.
That is a great choice, Philip. There are two types of movement disorders that result as negative side effects of medications used to treat neurological and mental disorders: dystonia and tardive dyskinesia.
Now, recently, there are many national commercials that talk about tardive dyskinesia and many new medications to help to try to treat it.
Yes, there are. Tardive dyskinesia and dystonia are movement disorders both caused by increased signaling of nerves from the brain to different muscles in the body, resulting in involuntary muscle contractions and movements. Depending on the length of time taking certain medications, these disorders can become irreversible. While similar, tardive dyskinesia and dystonia are different conditions, presenting with different symptoms.
Tardive dyskinesia is characterized by irregular, involuntary movements, most commonly in areas of the face, eyes, and mouth, including the jaw, tongue, and lips. Common involuntary movements seen in patients with tardive dyskinesia include abnormal tongue movements, lip smacking or puckering, grimacing, and excessive blinking. Symptoms may also occur in the trunk, arms, and legs. These movements can be rapid, jerky, and twitch-like. This is what I was referring to in our past videos. However, sometimes these movements can also be slow and writhing as well. The definition of tardive means late onset, indicating that these abnormalities of movement typically arise in people who have been taking certain medications for an extended period of time. This condition may persist even after a medication is discontinued.
Okay, breathe. Dystonia describes involuntary muscular contractions that cause sustained and repeated motions or abnormal postures. Dystonia most commonly affects the head, face, and neck and is sometimes painful and worsens with voluntary movement.
Unlike tardive dyskinesia, which typically takes a longer time to develop, dystonia can occur within hours or days, usually within the first 5 days, of initiating treatment with an antipsychotic medication, or increasing the medication's dosage. Tardive dyskinesia occurs as a side effect of taking certain medications, like antipsychotics, to treat mental disorders, and those medications in the category of dopamine receptor blockers. It may take months or years of taking these medications for symptoms of tardive dyskinesia to develop.
The antipsychotic drugs chlorpromazine, haloperidol, and perfenazine are used to treat schizophrenia and other mental disorders. They have all been significantly linked to causing symptoms of tardive dyskinesia. Tardive dyskinesia may appear more quickly in older people who have been taking antipsychotic medications for a shorter period of time. There are also certain risk factors associated with tardive dyskinesia. The risk factors for developing tardive dyskinesia from use of antipsychotic medications include being female, being of African American descent or ethnicity, or having a prior injury to the brain or history of dementia.
Now, unlike tardive dyskinesia, dystonia has a variety of different causes. Dystonia can be acquired or drug-induced, resulting as a side effect from taking antipsychotic medications. But other acquired causes of dystonia include infections, tumors, exposure to toxins, brain injuries from head trauma, brain surgery, or during development before birth. Other forms of dystonia can be inherited through different genetic mutations, and dystonia can occur idiopathically, meaning that the underlying cause is completely unknown.
Tardive dyskinesia and dystonia are typically diagnosed by a neurologist or a psychiatrist based on your symptoms, list of medications you are taking, prior medical history, and reported symptoms of involuntary muscle contractions and movements that have been observed by a family member or friend. You may also have blood work and a computed tomography or CAT scan, a CT scan, or magnetic resonance imaging or an MRI of your brain performed in order to rule out other conditions such as a stroke, Parkinson's disease, Huntington's disease, cerebral palsy, or a brain tumor, which can also cause abnormal movements.
Treatment for tardive dyskinesia usually begins with lowering medication dosage to see if symptoms decrease. If a lowered medication dosage is ineffective, a type of medication called vesicular monoamine transporter 2, or VMAT2 inhibitor, will be prescribed to decrease involuntary movements. There are several of these on the market. Your healthcare provider can go over those medications, with you to see if one would work better than another. The mechanism, or how the drug works, is the protein VMAT2 controls the transportation and release of neurotransmitters from nerve cells to muscles. VMAT2 inhibitors block the activity of this protein, which can help decrease nerve signaling to muscles and reduce excessive involuntary movements. If VMAT2 inhibitors fail to reduce the symptoms of tardive dyskinesia, clonazepam, a benzodiazepine used to treat seizures, or ginkgo biloba, a plant extract from the leaves of ginkgo trees, may be prescribed to help decrease symptoms.
Now, treatment for dystonia most commonly involves taking anticholinergic medications, which block the action of the neurotransmitter acetylcholine. Anticholinergic medications are ineffective for decreasing the symptoms of dystonia. Antihistamines or benzodiazepines may be prescribed to help manage the symptoms instead. Other treatment methods for dystonia include injections of a botulinum neurotoxin, commonly known as Botox, into contracted muscles to decrease pain and tightness. Another treatment is deep brain stimulation to an area of the brain called the internal globus pallidus, which regulates voluntary movement and causes movement disorders when damaged. Electrodes would be surgically implanted into your brain to send electrical impulses to help regulate muscle control.
So a quick recap is tardive dyskinesia and dystonia are both movement disorders that result from taking antipsychotic medications. Tardive dyskinesia causes involuntary movements, most commonly in areas of the face, eyes, and mouth. Dystonia, on the other hand, leads to involuntary muscular contractions that can affect the head, face, and neck. Unlike tardive dyskinesia, dystonia can also be caused by infections, tumors, exposure to toxins, and brain injury. The best way to treat and prevent both conditions is to reduce the dosage of the medication that's causing symptoms or to change the medication entirely.
Now, while antipsychotic medication is often necessary and very beneficial for managing the symptoms of schizophrenia and other mental health disorders, it can cause negative side effects like involuntary movements, like what Philip referred to in the beginning of this episode. It's important that your doctor supervises you regularly while you are taking these medications to screen for movement abnormalities. If you're experiencing any negative side effects from your medications, you should definitely tell your doctor immediately so that your type of medication or dosage can be adjusted to help minimize those side effects. If changes to your medication cannot be made, other types of medications may be prescribed to help manage the side effects.
Regular follow-up with healthcare providers is essential to monitor the progression of symptoms, the effectiveness of treatments, and any potential side effects of medications. A multidisciplinary approach involving psychiatrists, neurologists, and other healthcare professionals can help optimize the management of tardive dyskinesia and/or dystonia. I hope this video helped explain what I am personally experiencing, and I hope it's given you guys out there some answers as well. Thank you guys so much for watching today's episode, and remember, it's okay not to feel or be okay all the time. You are not alone.
No, you guys are not alone. Thank you so much for tuning in to Navigating the Periphery. We are trying to stop the stigma of a mental health diagnosis one show at a time. And until we see you again in our next episode, coming really, really soon, take care, have a wonderful evening, and we'll see you soon. Bye for now.
Bye.